right, I think we are live, so I will get us kicked off. Good morning, everyone. My name is Dustin Beekman. I am the Director of Business Development here at the Medical Society of Virginia. We are pleased to partner with Abyde this morning to bring you our webinar, HIPAA Compliance and Your Practice. I'd like to take a moment to welcome our speaker, Cole Morgan. Cole is the Director of Education at Abyde and is an experienced educator on HIPAA compliance. Cole's background has allowed him to gain detailed insights on the challenges of achieving and maintaining compliance as an independent provider, including the difficulties and common mistakes in meeting government-mandated HIPAA requirements. Abyde, the industry-leading HIPAA compliance solution, has provided education across the country to providers of all specialties since 2016. Now, just a few housekeeping items. If you'd like to ask a question, please utilize the Q&A function at the bottom of your Zoom screen. If your question is not answered, please email the MSV team at memberservice.msv.org. That's memberservice@msv.org. As with all of our webinars, this session will be recorded and posted to our website. On behalf of all the membership and staff at the MSV, I'd like to thank you all for taking some time to be with us this morning. I'll now hand it over to Cole.
Awesome. Thank you, Dustin. I appreciate the introduction. And hello, good morning to everyone. Hope everybody's got their coffee. Happy Friday. Like Dustin said, my name's Cole. I'm the Director of Education at Abyde. Abyde is the Medical Society of Virginia's preferred HIPAA compliance partner. We are honored to be chosen as the vehicle to carry out today's message on behalf of the MSV. We'll talk a little bit more about Abyde as we go through this. But we wanted to tell you that we appreciate you taking time today and joining us. As you can see from the title of the webinar, today we're going to simplify HIPAA compliance for you and your practice. We've been doing these webinars for MSV members since we became partners, and the response to them has been tremendous. So we expect you all to have the same experience. So we'll go ahead and we'll get started here. This next slide, that's me. There's my contact information. I'm going to also put that in the chat. So if you have any questions, you'll have my information to get in touch with me after this webinar. So we want to start out and figure out, what does HIPAA stand for, right? The acronym HIPAA stands for the Health Insurance Portability and Accountability Act. Now, 95% of the time when I ask somebody what HIPAA stands for, they tell me health, information, protection, and then they get hung up. And that's because that's what we know HIPAA to do. The acronym Health Insurance Portability and Accountability Act doesn't tell us about your roles and responsibilities when it comes to HIPAA compliance in your practice. So again, that's the goal today, is to break this down and simplify this. When we look at the timeline that exists for HIPAA, so it's a 25-year-old law. HIPAA was signed into effect August of 1996. But when we look at enforcement around HIPAA compliance, it's still very new. The government did not commit to enforcing HIPAA compliance until March of 2013. They also did not put a proactive audit program in place until 2016. So when we look at enforcement and what the landscape of HIPAA compliance is going forward, it's very different than what it's been in the past. So we just want to make sure everyone's aware of what that looks like. There are some meetings taking place in DC currently where they're talking about amending and changing some guidelines around HIPAA compliance. A lot of that has to do with patient access and some timelines as far as that patient access goes. We're keeping a close eye on that. Obviously, as soon as anything is official, we're going to, be letting our members and our partners and their members know that. So just know we're keeping an eye on that. To talk a little bit about who we are at Abyde, we're a technology company in Tampa, Florida. We're comprised of HIPAA experts and leaders, and our goal is to provide HIPAA education and solutions for medical practices. We understand that your practice environment is different from that of a big hospital or health association. So what we want to do is provide you with the education and the opportunity to be as HIPAA compliant as that big healthcare system, while again understanding your resources and your personnel are allocated differently. Today's agenda, We're going to go over some enforcement examples. We're going to talk about where you stand. So I'm going to have everyone do what's called our HIPAA challenge. This is going to give us a good idea of where your practice is at. We're then going to talk about the path to HIPAA compliance. We're going to break down what goes into being truly HIPAA compliant. And then we'll talk about also how Abyde can help you with HIPAA compliance going forward. When we look at what triggers a HIPAA investigation or an audit, there's three things: a patient complaint, a breach, or that proactive audit program. The important thing to remember with these three things is they're out of your practice's control. When we look at HIPAA patient complaints, this is obviously not something that we want to see trending up, and up, but that is what's happening with this. Our support team has actually seen a huge increase in the number of calls that we've received from the general public disgruntled, Googling HIPAA and wanting to file a complaint. We tell them that's not where you do this. We're a HIPAA compliance company. You have to call the government and file that with them. But again, we're seeing this rise in complaints firsthand. And what we want you to understand is all it takes is one single complaint, even if it's totally unfounded, and that can cause a full-scale HIPAA investigation. So something to be aware of when we talk about patient complaints. Now, when we talk about how new enforcement is, how recent HIPAA enforcement is, this slide shows that. When we look at the last 4 years, 75% of the total of all HIPAA compliance fines are in that last 4-year period. I think we can all appreciate that if the government drills for oil and they find it, what do we think they're going to keep doing, right? So we don't see enforcement slowing down. We see this as really just the tip of the iceberg. We want to make sure everyone is aware, again, of the reality of enforcement that's going on right now. When we look at HIPAA fines just from last year, 95% of those fines were related to one specific area, and that's cyber attacks or cyber-related breaches. The important thing to remember, though, is these fines were not levied because the practice just got unlucky. They were fined because there was a breach that acted as a trigger point for a full HIPAA investigation. And then the government found systemic non-compliance, as they put it, in every single instance. So remember, just because there's a breach, just because there's a patient complaint, does not automatically equal a fine. If you're doing what you're supposed to be doing, if you have the documentation that the government wants you to have, you're protecting your practice. The other chunk up there, those right of access, you can see that there. That's patient right of access fines. That was failing to provide a patient with their records upon request within a timely manner and in the format requested. So that's something we'll talk about a little bit further into the webinar. When we look at HIPAA penalties, there are obviously monetary fines that go behind HIPAA violations. They go up in severity with the severity of the violation. What we want you to understand about this is the smallest HIPAA fine we've ever seen is $3,500. So we are not talking about, a parking ticket, a couple $100, we'll fix it and not worry about it. This is a lot of money. It can be very damaging to any sized organization. And then we also want to point out that there are criminal penalties associated with HIPAA violations. Now, these are extremely rare, but they do happen. These are really reserved for an infraction where there's malicious intent. So again, we don't see them all that often, but it shows us that the government is very serious about HIPAA compliance if they're going to tack on, criminal penalties to these violations. So that's it for the doom and gloom. Here's the good news when we talk about HIPAA compliance. So the government, they've taken a huge step to incentivize covered entities to protect themselves from HIPAA fines. So it's not really earth-shattering information, but under the HIPAA safe harbor law that the government enacted, it's a bipartisan bill. And what they're doing is they're encouraging covered entities to implement HIPAA standards that meet federal and state laws. So they've said that they will reduce penalties for those who are compliant should there ever be a HIPAA incident like a data breach or a patient complaint. This is a brand new amendment to the HITECH Act, which governs healthcare information technology, so healthcare IT. And it was just passed January 5th of 2021. So again, practices who achieve basic security measures, particularly with that climate of growing cyber threats, that incentivization is there. So if you can comply with the HIPAA security rule and implement appropriate technical safeguards for any vulnerabilities that you identify in your security risk analysis, and you can show that documentation for 12 months prior to any HIPAA incident, like a breach, a complaint, a proactive audit, the Office for Civil Rights has said that they will reduce fines, cut short any HIPAA audits, or reduce any corrective action plans that they otherwise would have imposed. So this is a good thing to see. We are hoping that we see practices really step up and take this as the extra little incentive to go and get HIPAA compliant. So now we're going to go through our HIPAA challenge. We want to see where you stand. This is going to give you an honest idea of what the HIPAA compliance program at your practice looks like. So you'll get a little report emailed to you. It's going to give you a grade. It's also going to give you an areas of concern. So it's going to pinpoint and really point out things that we need to focus on this year, next year, going forward. So pull out your phones, or if you're on your computer, you can type that abyde.com/HIPAA challenge/MSV into your search bar. Or if you just hold your camera over that QR code, it'll pull up the HIPAA challenge. I'll give everybody a minute to get that up. And then while you're doing that, we'll kind of keep moving through the webinar. So everyone go ahead and do that. Probably the only webinar educational thing where someone will tell you to take your phone out. But go ahead and get that up, and then we'll keep going. So the best place for us to start with the path to HIPAA compliance is defining HIPAA compliance. So when we talk about the definition of HIPAA compliance, normally I'll ask practices, what do you have in place? What are you doing? And people tell me, oh, well, we don't talk out loud about patients' information, and we protect our computer screens, and we make sure we don't leave charts lying around. And a lot of these things are it's like muscle memory behavioral things from just working in a medical practice. And that's great. That's what we call a culture of compliance. But the way that we need you to look at HIPAA compliance and to define it is by this definition. And it's documented proof that there is a culture of compliance within your organization. So the culture of compliance protects your patients. The documentation protects your practice. I always tell people you could have the Fort Knox of HIPAA compliance programs, but if it's not documented, the government's not going to give you credit for it. So what we're going to talk about in this next part is really about documentation. And the best way to do that is to break HIPAA compliance down from kind of the big scary blob that it can be. And we want to look at it the way that the government views it. This is how an auditor will look at HIPAA compliance, and it's looking at each individual part and piece. We need all of these pieces of the puzzle working together to be truly HIPAA compliant. So now we're going to go through and talk about what each puzzle piece looks like. The first piece we're going to talk about is the security risk analysis. So what we're doing with this security risk analysis is we are identifying and documenting physical, technical, and administrative safeguards. This is a self-evaluation of your practice within those three categories of safeguards. And the government wants you to evaluate what's in place, and then they want you to assign a risk level to those things and understand what you need to do to mitigate those risks. This is where it can get kind of tricky. Again, if we're asking the right questions, then it's fairly easy to see what's a high risk and what's a low risk. But we need to be identifying these things. This is to show the government I'm not overlooking anything. I'm totally aware of what I'm doing. It's the responsibility of your practice. It has to be done annually. It's also the first step in HIPAA compliance. We know that it's one of the first things an auditor will ask for. And the government has come out and said that compliance has not been achieved without a documented risk analysis. Any practices that are out there and that are in the MIPS program, and when you attest to MIPS, the documentation that goes along with that, this risk analysis is extremely important for you as well. There's a little bit of an elevated risk for the proactive audit program for practices that are in MIPS. So just know this is something that every practice has got to get done. This is the foundation of your HIPAA compliance program. When we look at the phases of HIPAA compliance, there's 2 phases to HIPAA compliance. The first one is the security rule. That has the risk analysis in there. That's what we just talked about. Everything else up here comes from the privacy rule. And the privacy rule says that you have to have an ongoing compliance program to help mitigate any risks you found in your risk analysis. This is a fairly logical next step, right? We're going to identify risks in that security risk analysis, and then we're going to do risk mitigation. We're going to reduce those vulnerabilities that we identified, those things that we saw as a high risk. We're going to work on those throughout the year. Again, this is an ongoing process. The next step is having a formal HIPAA training program. So there needs to be a HIPAA training program for your employees and your doctors at minimum once a year. The best practice, what our recommendation is that you conduct training in a modular type format. So that would require you to have a quiz at the end. We also want to see that all new employees are trained within 30 days of coming on board. Ideally, you train them day one when they are onboarded into the practice before they ever have a chance to be around patients' data. But if that doesn't happen, we need to see that within 30 days. Just to make sure that everyone's getting the training that they need to know the importance of HIPAA compliance. Our next step is policies and procedures. So we're talking about documentation. So this is a big one. These are vital to your practice in the case of an audit. Think of these like your practice's receipts. This is that documentation that shows you do everything that you say you do. Now, the importance of policies and procedures, the government has actually come out and said from their last round of audits that they found practices were using generic policies and procedures and that they did not meet their requirements. So a lot of the practices that still had generic policies and procedures, the government said, well, you're non-compliant. So these need to be specific to your practice. We have to really be looking at that risk analysis, looking at what you do and what safeguards are in place, and making sure that your policies and procedures reflect that. We also need to look at state regulations, state timelines, and federal laws and timelines around HIPAA compliance. Some states have varying timelines with certain things, so we want to make sure that we are staying on top of that. Next is patient authorization and consent forms. So getting HIPAA authorization forms and consent forms signed is an important piece of the puzzle. We see most practices do a great job with this. The disconnect that we see is that a lot of practices feel like just getting these signed makes them HIPAA compliant. This is obviously an important piece to the puzzle, but it's just one piece of this bigger picture. So we have to make sure we're doing this, but we have to make sure we're getting all these other puzzle pieces working together with patient authorization and consent forms. Every organization has to have a HIPAA manual. The government says this is just an organized area for you to access your risk analysis, your policies and procedures, and your other HIPAA documents as necessary. So it can be physical or electronic. We recommend that you at least have a copy of these documents in electronic form. This makes sure that you still have access to documentation in case there's a fire or a flood, and it prevents anything from getting misplaced. So this is another really big point of emphasis for the Office for Civil Rights lately, and that's business associate agreements. So number one, we have to identify who our business associates are. These are third-party vendors that have access to patients' data. So IT companies, consultants, your EHR and practice management companies, any third-party billing companies, telehealth, or patient communication like texting and emailing platforms. But what you need to do is get these business associate agreements signed and in place with all of those kinds of vendors that you work with. And what this does, it's a legal document that offsets the liability of your practice in case of a breach. So in case that IT company has a breach, something happens and it potentially affects your patient's data, having that business associate agreement in place, it's there to protect your practice. These are vital to your documentation and your HIPAA compliance program. So the last piece of our puzzle here is an updated risk analysis. So this has created a lot of pain for practices, right? Getting this risk analysis done, number one, but then keeping it updated. The government wants you to have an updated and complete risk analysis at minimum once a year. But what we've found is that every time you try and go do that, it's like you're reinventing the wheel. So it's the same amount of work every year over and over. What we recommend is that you keep your risk analysis updated on a continual basis. What this does is it minimizes the amount of work you have to do overall, right? If we do a little bit, a lot, it prevents it from being this big, overwhelming thing that ultimately we found just doesn't get done. So this is what any good HIPAA compliance program looks like. It's, again, all of these pieces coming together to create your culture of compliance, but more importantly, to document your culture of compliance. We want to look at some enforcement trends. This is the areas that we've identified the government is enforcing HIPAA compliance now more than ever. We've got the government's audit report, and we went through that audit report to find these statistics. So this is the data that they're giving us. This was released in this past December, and a lot of alarming numbers here. One big one, only 2% of covered entities meet all HIPAA requirements. Again, it's a pretty staggering number when you think about how much patient data is out there, potentially unprotected without the required HIPAA safeguards in place. You know, we're all patients somewhere. So that's obviously something that we want to see improve as the year goes on and next year. So when we dive deeper into these results, it's important to look at these as areas that the Office for Civil Rights sees as opportunities for enforcement as well. They've identified them as weak spots. They're definitely going to continue to enforce them when practices don't meet these requirements. So the first bar chart here, only 2% of practices met all notice of privacy practices requirements. So this means most either failed to provide the required document to patients, or they had something that didn't meet all the right requirements for where to post it or what information should be included. Only 11% of practices met patient right of access requirements. Not meeting requirements either means the practice didn't meet the right time frame for providing records, or they didn't provide the right type or format of records requested. 67% of entities failed to meet breach notification timeframe requirements. So this means when a breach occurred, the practice did not let patients know within a lawful time frame. That's essential to meeting breach notification rule. Only 14% of covered entities completed a security risk analysis. When we say that, this is an appropriate government standard risk analysis. It's one of the most common things we see among practices. And lastly, whether or not they completed a security risk analysis, even less, 6%, actually implemented an appropriate ongoing risk management program around those results. So the common themes here are around patients, basic HIPAA requirements, and handling breaches correctly. You can bet this is where we're going to see the government continue to enforce these things in 2021. So one specific area of focus for the Office for Civil Rights is patient right of access. We talked about this when we looked at the fines from last year, that pie chart, and also when we just went through those audit results, that report. So last year, the OCR was very busy. They got in numerous access-related fines, and that included 5 fines in one day. That was a record. We had never seen 5 fines in one day before. So recipients of these fines either refused to provide or delayed in providing patient records after the request was made by the patient or the patient's authorized personal representative. Federally, this is a 30-day requirement. One of the practices took almost 36 months to get these patients' records to them. The fines range from that smallest fine we've ever seen, $3,500, all the way up to $200,000, but the average fine was more than $27,000 for a patient right of access violation. When we look at the takeaways, again, understanding what timeframes your practice has to provide patient records and making sure that those timeframes and the required content is in your right of access policy. So another big trend, obviously, from last year's fine results was cybersecurity, right? So we've seen a lot of practices with cybersecurity missteps. Some things we want to make sure you understand. 2020 saw that record number of cyber breaches. That was both for covered entities and business associates. So we know a number of our own customers had business associates affected through hacking or phishing. This is why it's essential to have those business associate agreements in place before a breach occurs. We also want to, again, emphasize that the breach was not necessarily the cause of the fine. The fine was because they had no documented HIPAA compliance program in place, or they were missing key documentation and requirements. The breach just acted as the trigger point. We want you to remember that that HITECH Act just had the amendment for the safe harbor law. So we want to see practices take advantage of that. Getting basic technical safeguards in place is a huge importance when it comes to cybersecurity. And then also keeping an accurate asset log of all your devices and encrypted data, showing the government you've got positive control over all of that information. And then we've already mentioned business associates a couple times throughout this webinar, but again, they are that important. We've seen business associates rise as a cause of why practices are getting investigated or audited. So again, we just want to make sure everyone's identifying business associates and that they're getting those agreements signed and in place with everyone they need. We saw a provider last year get hit with a $100,000 fine because there was a complaint with their EHR company, and ultimately they did not have a business associate agreement in place. So getting those BAAs signed and in place again before you start working with any vendors, and then also ensuring that your vendors are putting proper safeguards in place to safeguard your PHI. Absolutely vet out your vendors, talk to them about what they're doing to protect your patient's data. When we look at federal and state audit letters, this is a federal audit letter. This is a very good example of just because there's a breach does not mean your practice is going to get fined. This was an Abyde customer. They had a laptop stolen. So they called us, they found out we had got to report this breach. There was going to be an audit. We went through the audit process with them. They had all their documentation because they were using Abyde. So we gave that to the government. We went through the audit with them. At the end of the process, the government said, based on the information and evidence described above, no further action is required. So again, if you've got the documentation in place, then you're good to go. You're protecting your practice. When we look at the state audit letter, this audit was caused by an office manager accidentally carbon copying 400 patients on a promotional email. So a couple wrong clicks of a button, and what happened was 400 patients' emails were breached. The state came in. They wanted to see administrative safeguard policies and procedures, technical safeguard policies and procedures, and physical safeguard policies and procedures. Those are all coming out of those three categories that we look at on your risk analysis. They also wanted to see the risk analysis conducted immediately before that disclosure. So this is why an updated risk analysis is so important. So when we look at the questions that we want you to consider going forward, we need you to think about these things all throughout the year, and it's your risk analysis. How are you going to get it complete? How are we going to update it? Your documentation. How are you going to draft that documentation? How are we going to keep it up to date? HIPAA training. How are we going to get a formal training program in place? Are we going to get those quizzes done? Modular form. HIPAA changes, staying up to date with state and federal regulation changes when it comes to HIPAA compliance. These are all the things you have to think about with your compliance program. And then the big question, obviously the biggest one of them all, if there was to be an audit, a data breach, or a complaint tomorrow, are you comfortable with the documentation that's in place? If your answer is anything other than absolutely yes, that's the other reason why the Medical Society of Virginia has partnered with us. So we are able to help you with your HIPAA compliance program. Abyde is designed to give your practice a complete HIPAA program with continuous updates. We have a very simple, easy to use software. Think of it like TurboTax for HIPAA. And we also have a wonderful support and audit protection program. So I'm going to jump over real quick and I'm going to give everybody a quick look at Abyde. So this is our dashboard within Abyde. Again, think of this like TurboTax for HIPAA. What drives this dashboard is our notification system. So we want to take the guesswork out of HIPAA compliance. If there is something that you need to do with your account, we will send you a notification. We'll tell you exactly how to do that, how long it's going to take. You will not be left wondering, did I get everything done? Is there anything more I need to do? I hope I did it right. We're going to have you complete your security risk analysis when you first get in. Remember, this is the first thing that we need to do to become HIPAA compliant, right? This is the foundation of our HIPAA compliance program. You're going to simply answer yes, no, or don't know to all of our questions going into physical, technical, and administrative safeguards. 30 to 45 minutes, you're done with that risk analysis, and you never have to do it again. The reason you never have to do it again is because we have an ongoing compliance program. So we're going to prioritize, oh, I got logged out. Let's log back in. We're going to prioritize what we've identified as high risks, and we're going to ask you 3 to 5 of those high risk questions a month. So it's 5 to 10 minutes from you. And all we're going to do is answer yes, no, or don't know to these questions. By doing this, we are constantly updating and evolving your security risk analysis. We're just keeping your HIPAA compliance program up to date, little bit at a time. 5 to 10 minutes a month is all it takes. We dynamically generate your policies and procedures. You do not have to edit these. You do not have to update these. These are not templates. These are just here for you to use, dynamically generated by our software. We have a business associate portal. You can electronically send out your business associate agreements. It's as easy as putting in the name of the company and their email address. They're going to electronically sign that, and that business associate portal or business associate agreement will go right into that portal and stay there. Our HIPAA training program. So we send out our training videos via email. Your employees do not have to log into Abyde. What they'll get is a link in their email to open up a quick, we've made it as fun as possible, a quick, fun HIPAA video. Once they go through their training, 12-minute video, we're going to take you right over and push you right to that quiz. Remember, modular form. We're going to answer our 10 quiz questions correctly. If somebody answers a question incorrectly, we're not going to let them move on. They need to get the answer right. And then we're going to give you a certificate. That certificate is documentation that your employees went through their training program and they retained their information. We provide HIPAA logs, a breach log, and breach reports here. And then the two things that really set us apart, our support and our audit protection. So our support team, they are full-time HIPAA experts. What they are there for is to give you the confidence and assurance that if you have a question about your HIPAA compliance program or something that's happening in the office, you have a place to go to get the answer. You will talk to someone. If you call our support line, you will talk to one of us. With our audit protection, so God forbid there's a breach, a patient complaint, or an audit. You click the big red button. That tells us that your practice is being audited. We are going to call you, tell you not to worry. We're going to find out if it's a federal or state audit. We're going to walk you through that audit process, start to finish. We've never had an Abyde customer fail an audit or pay a dime to the government. We are extremely proud of that track record. So that is how we handle HIPAA compliance for you. This is the most efficient and easy way to be HIPAA compliant and stay HIPAA compliant. So what we're going to do for our MSV members is give you a 25% off promo code here. HIPAA Luck because of St. Patrick's Day. So until March 17th, you can use HIPAA Luck. It's essentially 3 months free off of Abyde. So again, you can go to abyde.com and get some more information there. I'm going to put my contact information in the chat. And then that way, if you have any questions or if you want to go get a demo, a little bit more in-depth look into Abyde, we can get that scheduled for you as well. Dustin, I'll pass it back over to you. That's all I've got today. I appreciate you all letting me present and talk to everyone about HIPAA compliance.
Great, Cole. Thank you. That was an excellent presentation. Very, very informative. It seems like every time I hear you guys, I learn something new about HIPAA. So that was excellent. Thank you. We will kind of move to the chat. Is there any questions? Not seeing any in the chat. Taylor, I'm not sure if you see any either.
No, I do not.
Okay, yep. So it looks like Cole just put his contact information. So with no questions, it is always a goal of ours. Looks like Dr. Corin already had a question, so I'll let Cole and Chris handle that. Maybe you guys can reach out to Dr. Corin and have that discussion. But it is always our goal to finish on time or early. So we're giving you guys a gift of 20 minutes back for this Friday. It's great weather here in Richmond anyway, so hope everyone enjoys the day and enjoys the weekend. Thank you for participating, and everyone have a great Friday.